name is Ariana Tola. Today is May 26, 2026, and I will be showing a feline ovariohysterectomy procedure today. The step that I will be showing is going to be how to do the final preparation, which includes our final scrub prior to the doctor starting the procedure. I'm going to be utilizing the dirty hand, clean hand method and using a target pattern. I will go ahead and start with chlorhexidine first so that I can have the largest amount of contact time so that it can be most effective. Starting from the middle where the incision site will begin, and using my target pattern to reach the outer edges of the suture of the surgical site. When I reach the edges where the fur is, I will go ahead and discard that gauze and start over. So chlorhexidine is going to help aseptically prep this suture site and disinfect it as well. Okay, that was the end of my chlorhexidine. This is the last one. Now I'm going to be utilizing the alcohol, which will help rinse off the chlorhexidine while still disinfecting the surgical site area. That's how you perform the final preparation on a feline ovariohysterectomy stay.
So now that the surgery is all finished, I will be discussing the types of sutures and the instruments that we used for this procedure. So for this procedure, we usually would do PDS for the internal ligation and closing of the abdominal wall, followed by monocryl for our skin sutures, followed by surgical glue. But for this procedure specifically, the doctor actually used only PDS, and that was 3-aught PDS, which is a reverse cutting suture. And so we used that for the internal ligation and the abdominal muscle and the skin, because this patient was undergoing heat. So because of the integrity of the tissues and the skin, our doctor felt that it was appropriate to use 3-aught PDS. And then we also finished by using surgical glue to go ahead and secure the incision site closed. During the procedure, there was various instruments used. I will go over just a few of them. These are Brown Atzin tissue forceps, and they haven't been sterilized or cleaned yet, but they are used to grasp and manipulate tissues, delicate tissues. They do have teeth on the ends. They have a jagged set of teeth. It's a little hard to see. There you go. So Brown Atzin tissue forceps. We have a Mayo Hagar needle driver here, which is used to actually grasp the surgical needle and suture and help facilitate suturing and closing of the suture sites. Here we have backhouse towel forceps that are used to clamp and attach the drape or surgical towels to the patient. Here we have Metzenbaum scissors. These are used to cut through delicate tissues, such as loose connective tissue, fat tissue, things like that. And then last but not least, we have our cryo forceps. And then these are used also for occluding large vessels and also handling delicate tissue as well. But we can use this to occlude our larger vessels to stop the blood flow before cutting or anything like that. So those were the instruments and the sutures that we used for this feline ovariohysterectomy procedure.